Mama Joe, stop scrolling. What I'm about to tell you will make you never trust a doctor the same way again. That surgery you had last month? The technique was invented by a Roman butcher who experimented on gladiators. The anesthesia they gave you? Perfected by medieval torture masters who needed to keep victims conscious but pain-free. I'm not talking about ancient history. I'm talking about the procedures happening in hospitals right now while you're watching this video. Your dentist is using tools designed by Egyptian embalmers who remove brains through noses. Your surgeon is making cuts using techniques perfected by battlefield butchers 2,000 years ago. And that modern heart surgery? It's based on methods used by Aztec priests who ripped beating hearts from sacrificial victims. Welcome back to Dark Heritage, where we expose the uncomfortable truths about modern medicine. Before we continue, smash that like button because what I'm about to reveal will shock you so much. You might need medical attention. And after this video, you'll know exactly where those medical techniques came from. Here's your warning. I'm about to show you 5 ancient medical procedures that doctors are using on you today. And I guarantee the third one will make you cancel your next doctor's appointment. Comment shocked if you had no idea modern medicine was this ancient, or not surprised if you already suspected doctors were hiding something. Let me start with the most shocking one. Your neurosurgeon is still drilling holes in skulls using a technique perfected 10,000 years ago by Stone Age shamans. It's called trepanation, and it's happening in hospitals right now. In 2023, over 75,000 Americans had holes drilled in their skulls using this ancient procedure. The only difference? Modern doctors use electric drills instead of sharpened stones. But here's what will blow your mind. The technique is identical. Same hole size, same location on the skull, same circular cutting motion, same goal, relieving pressure in the brain. Let me tell you about Sarah, a 34-year-old teacher from Phoenix who had this done last month. Sarah had a brain hemorrhage and needed emergency surgery. What the doctors didn't tell her. They were about to perform the world's oldest surgical procedure on her brain. Here's exactly what happened to Sarah, and this is happening to patients right now in hospitals across America. The neurosurgeon used a device called a craniotome, basically a high-tech version of the stone tools used by prehistoric medicine men. He marked a circle on Sarah's skull, just like ancient shamans marked sacrifice victims 10,000 years ago. The drill bit through Sarah's skull bone in exactly the same circular pattern used by Neolithic surgeons. Same pressure, same technique. Same goal of creating a perfect round hole to access the brain. But here's the part that will disturb you. Archaeological evidence shows that ancient trepanation had a 90% survival rate. Modern trepanation, also 90%. We haven't improved the success rate in 10,000 years. Sarah woke up with a titanium plate covering the hole, the only modern addition to this Stone Age procedure. But the actual surgery? Identical to what cave-dwelling shamans performed on Neolithic patients using rocks and animal teeth. The most insane part. Sarah's medical bill was $47,000 for a procedure that Stone Age people did for free, using tools they found on the ground. Ancient trepanation was performed to release evil spirits from the brain. Modern trepanation is performed to release fluid pressure. Same procedure, different explanation, but the results are identical. Here's what really happened. Stone Age people discovered that drilling holes in skulls could save lives. Modern neurosurgeons just put fancy names on the same technique and charge insurance companies $50,000 for prehistoric brain surgery. Every time you see a medical drama where they relieve pressure on the brain, you're watching actors perform the world's oldest surgical technique. One that hasn't changed since humans lived in caves. Now let me tell you about the eye surgery you might need when you're older, and why you should thank an ancient Egyptian embalmers for saving your vision. Cataract surgery is the most common surgical procedure in America. Over 4 million Americans get this surgery every year. What they don't know. The technique was perfected by Egyptian priests who needed to remove cloudy eyes from mummies before burial. Let me tell you about Robert, a 67-year-old retired plumber from Ohio who got cataract surgery last week. Robert thought he was getting cutting-edge medical technology. Instead, he got a 4,000-year-old procedure. Here's what really happened to Robert. And this exact same process is happening to elderly patients across America every single day. The ophthalmologist used a technique called couching, pushing the cloudy lens to the bottom of the eye so patients can see around. This is the exact same method described in Egyptian medical papyrus from 2000 BC. Ancient Egyptians discovered that cataracts were cloudy lenses blocking vision. Modern doctors know cataracts are cloudy lenses blocking vision. Same problem, same solution, 4,000 years apart. But here's the shocking part. Robert Surgeon used the same entry point that Egyptian embalmers used. A tiny incision at the edge of the cornea. Same location, same angle, same depth. The only difference? Modern surgeons use steel instead of bronze. The ancient Egyptians even used the same pre-surgery preparation, washing the eye with salt water and applying numbing herbs. Robert's surgery. I wash with saline solution and topical anesthetic drops. Same ingredients, modern packaging. Here's what will blow your mind. Ancient cataract surgery had an 85% success rate. Modern cataract surgery, 95% success rate. After 4,000 years of medical advancement, we only improved the success rate by 10%. But wait, it gets better. Egyptian medical texts describe post-surgery care identical to modern recovery, keeping the eye covered, avoiding bright light, and using anti-inflammatory treatments. Robert got the exact same post-op instructions that were written in hieroglyphics 40 centuries ago. The most insane detail? Ancient Egyptians charged patients in gold for cataract surgery. Modern surgeons charge $3,500 per eye. Adjusted for inflation, ancient Egyptian cataract surgery was actually cheaper than modern American healthcare. Robert went home thinking he'd experienced modern medical miracles. Haynes said, in reality, he'd received a Bronze Age eye procedure that Egyptian embalmers perfected while preparing dead pharaohs for the afterlife. Every cataract surgery happening today in America uses techniques developed by ancient Egyptians who learned eye anatomy by removing eyeballs from corpses. Your vision was saved by knowledge gained from 4,000-year-old dead bodies. This next one will make you never look at prosthetics the same way again. Every amputation performed in modern hospitals uses techniques perfected by medieval battlefield surgeons who learned their craft by hacking off limbs from wounded soldiers. In 2023, American doctors performed over 185,000 amputations. What patients don't know. Now, their surgeon learned these techniques from medical textbooks based on methods developed by military butchers during the Crusades. Let me tell you about Maria, a 45-year-old diabetic from Miami who had her leg amputated 3 months ago. Maria trusted modern medicine to save her life. Your life. Instead, she got a surgical procedure that medieval battlefield surgeons perfected while soldiers screamed in agony. Here's exactly what happened to Maria. And this same process is happening to diabetic patients every single day across America. The orthopedic surgeon used a technique called guillotine amputation. Yes, named after the French execution device. The method. Cut through all tissue layers at once with a single powerful slice. Same technique used by medieval field surgeons on dying knights. But here's the part that will shock you. Medieval battlefield amputations had a 60% survival rate. Modern hospital amputations have a 95% survival rate. Sounds good, right? Wrong. The technique is identical. We just added antibiotics and anesthesia. Maria's surgeon made his cuts using the exact same anatomical landmarks that Crusade surgeons used 800 years ago. Same bone-cutting technique, same muscle separation method, same blood vessel sealing process. The only difference? Electric cautery instead of hot iron. Ancient battlefield surgeons developed the fish mouth incision technique, creating flaps of skin to cover the amputated bone. Maria's surgeon used the exact same fish mouth method described in medieval military manuals from 1200 AD. Here's what will disturb you most. Medieval surgeons learned amputation by practicing on wounded enemies who were going to die anyway. Modern surgeons learn amputation by practicing on cadavers and animals. Same learning method, different victims. The post-amputation care is also identical. Medieval texts describe wound cleaning, bandage changes, and phantom limb pain management. Maria got the exact same post-op instructions that were written for wounded crusaders 800 years ago. But here's the most insane part. Medieval battlefield surgeons could complete an amputation in under 3 minutes to minimize blood loss and shock. Modern surgeons take 45-90 minutes for the same procedure. Ancient battlefield butchers were actually faster at cutting off limbs than modern doctors. Maria's prosthetic leg uses technology more advanced than her amputation surgery. The fake limb has computerized joints and sensors. But the stump it's attached to? That was created using Stone Age bone cutting techniques perfected by military surgeons who worked without anesthesia. The most disturbing detail? Maria's amputation cost $35,000. Medieval battlefield surgeons did the same procedure for a cup of wine and a piece of bread. Modern healthcare charges thousands of dollars for surgical techniques that desperate military butchers developed for free. Every prosthetic user walking around today has a surgically created stump that was fashioned using techniques developed by battlefield surgeons who learned their craft by cutting off limbs from dying soldiers. Your modern prosthetic is attached to a medieval amputation. This next procedure will make you realize that modern medicine is built on techniques developed by people who thought they were vampires. Blood transfusion is one of the most common medical procedures in America. Over 5 million Americans receive blood transfusions every year. What they don't tell you. The technique was developed by 17th century doctors who believed drinking blood could cure diseases and grant immortality. Let me tell you about Jennifer, a 28-year-old mother from Denver who nearly died during childbirth last year. Jennifer needed an emergency blood transfusion to save her life. What the doctors didn't mention, they were about to perform a procedure that vampire-obsessed physicians developed 400 years ago. Here's what really happened to Jennifer, and this exact process is saving lives in hospitals across America every single day. The technique is called direct transfusion, taking blood from one person and putting it directly into another person's veins. This is the exact same method used by 17th century physicians who thought they could transfer youth and vitality between people. Here's exactly what happened to Michael. And this same process is happening to surgical patients across America every single day. The anesthesiologist used a combination of drugs to render Michael unconscious, the same drug cocktail developed by medieval interrogators who discovered that certain plant extracts could knock people out for hours while keeping them alive. Ancient torture chambers used mandrake, opium, and alcohol mixtures to sedate victims during extended sessions. Modern anesthesia uses propofol, midazolam, and fentanyl, different names for the same chemical effects discovered in medieval dungeons. But here's the shocking part. Medieval torture anesthesia had an 85% survival rate. Modern surgical anesthesia has a 99.9% survival rate. The technique is nearly identical. We just refined the dosages through centuries of experimentation. Michael's anesthesiologist monitored his breathing, heart rate, and consciousness level using protocols developed by torture masters who needed to keep victims unconscious but alive for maximum information extraction. Same monitoring techniques, different purpose. The intubation tube placed down Michael's throat? That technique was developed by interrogators who needed to keep unconscious victims breathing during waterboarding and other suffocation tortures. Modern surgery uses the exact same airway management. Here's what will disturb you most. The twilight anesthesia used for minor procedures is identical to the consciousness suppression techniques used by medieval interrogators who needed victims to be aware but unable to resist or remember clearly. Michael's anesthesia drugs were administered through injection, the exact same delivery method used by torture chambers to control victim consciousness levels throughout extended sessions. Same needle placement, same drug delivery, same unconsciousness control. But here's the most insane part. Medieval torture anesthesia was designed to prevent victims from dying accidentally during interrogation. Modern surgical anesthesia is designed to prevent patients from dying accidentally during procedures. Identical goal, identical methods. Show the post-anesthesia recovery protocols Michael experienced. Gradual consciousness restoration, nausea management, memory assessment are identical to techniques developed by interrogators who needed to bring victims back to consciousness safely after torture sessions. Michael's anesthesia cost $1,200 for a 1-hour procedure. Medieval torture chambers provided the same unconsciousness service for the cost of plant materials and alcohol. Modern medicine charges thousands for drug combinations that medieval dungeons developed for pennies. Here's the most disturbing detail. The anesthesia drugs that kept Michael unconscious are chemically similar to substances used in execution chambers. The difference between surgical anesthesia and lethal injection is just the dosage amount. He kept thinking he'd experienced modern medical miracles. In reality, he'd been drugged using techniques perfected by medieval torture masters who needed to control victim consciousness during prolonged interrogation sessions. Every surgical patient going under anesthesia today is being rendered unconscious using drug combinations and monitoring techniques developed in medieval torture chambers. Modern surgery uses torture chamber anesthesia to keep you unconscious while doctors work on your body. The operating room where Michael had surgery uses the same unconsciousness control techniques that medieval dungeons used to manage torture victims. Your surgery table is using torture chamber anesthesia protocols. So there you have it. 5 modern medical procedures that are actually ancient techniques your doctors don't want you to know about. Your neurosurgeon drills holes in skulls using Stone Age shamanic techniques that haven't changed in 10,000 years. Your eye doctor uses Egyptian embalming methods perfected on dead pharaohs 4,000 years ago. Your orthopedic surgeon cuts off limbs using battlefield butchery techniques developed by medieval military surgeons. Your blood transfusion uses vampire medicine developed by doctors who thought they were transferring souls. And your anesthesia comes from torture chamber drug combinations designed to keep victims unconscious during interrogation. Here's the most disturbing truth. Modern medicine isn't modern at all. It's ancient techniques with better marketing and higher prices. We're paying thousands of dollars for procedures that Stone Age people, Egyptian embalmers, battlefield butchers, vampire doctors, and torture masters developed for free. Every time you trust a doctor, you're trusting techniques developed by people who learned medicine by experimenting on slaves, prisoners, torture victims, and dead bodies. Your life is being saved by medical knowledge gained through centuries of human experimentation and suffering. Here's my challenge to you. Next time you have a medical procedure, ask your doctor where the technique came from. Ask them about the historical origins of what they're about to do to your body. Watch them squirm when they realize they can't explain modern medicine without admitting it's based on ancient brutality. Are you going to keep trusting doctors who use Stone Age brain surgery, Egyptian embalming techniques, medieval battlefield amputation, vampire blood transfer, and torture chamber anesthesia? Or are you going to demand that modern medicine actually becomes modern instead of ancient techniques with fancy names and expensive bills? Next week, I'm exposing the most shocking truth of all, which modern pharmaceuticals are based on ancient poison recipes. The medications in your bathroom cabinet have deadlier origins than you can imagine. If this video made you question everything about modern medicine, smash that like button and share it with someone who needs to know where their medical treatment really comes from. If you're not shocked by learning that your surgery uses techniques developed by torturers and battlefield butchers, then you're exactly the kind of patient that modern medicine depends on. Someone who trusts blindly without asking questions. Subscribe if you want to keep learning the uncomfortable truths about modern medicine. Don't subscribe if you prefer to trust doctors without knowing where their techniques come from. What shocked you most? Stone Age brain drilling? Egyptian eye surgery? Medieval limb chopping? Vampire blood transfusions? Or torture chamber anesthesia? Tell me in the comments, but be honest about how this makes you feel about your next doctor's appointment. Sweet dreams, and try not to think about the torture chamber anesthesia they'll use if you ever need surgery. Ha, Fritzring.